In this presentation, I am going to show how I would redesign a website of a medical facility that has not been updated for 15 years due to a lack of staff. I will discuss visuals and their organization, simplicity, and interactivity, along with charts, graphs, and images and how they impact the target patient audience. To make some of these elements more noticeable, I will sometimes go back and forth on these three slides here, where one slide shows the home page, one shows the contact page, and one shows the services page. First, I will discuss visual organization and simplicity. Even though photos change in different pages, we do not have a website where the designs change every slide. Based on what the lecture for Deliverable 6 Part 2 says, if the layout changes in each page, it will be a challenge to relearn the structure for each page, so it will be easier for patients to find what they need if the layout remains the same. Another way I had to maintain organization was to have the important information about the facility in the white box to the left of the images. This information includes the pie chart, contact info, and description of services and health insurance programs it has contracts with. Because the white box will grab the viewer's eye due to its size and contrast, it will make it easier for the viewer to find this information as quickly as possible. While visual simplicity is an important element for any website, it may be even more important in this situation due to us targeting patients. One way simplicity is used in these slides is that the only color in the design is blue, since, according to the module notes, blue can give the ill viewer a feeling of calmness from the discomfort or stress he or she may be going through. I also made sure the text in the blue boxes was all white and the same simple font so that it will be easily readable to the viewers. On the contact page, I put on a welcome video for patients considering visiting the site to watch. If they watch the video, then they can be introduced to every doctor that can be contacted. The lady in the video can describe the backgrounds of each of the employees listed in the contacts, and it will impact the potential patient to want to call the facility if he or she hears a positive background about the employees. Also, depending on the patient, each patient may want something different from a visit, so if the lady describes how they perform their services, it will make it easier for the patients to choose which employee they prefer. About charts and graphs, they are important tools to use to represent data. This chart on the home page gives simple communication on what waiting time to expect depending on what they are at the facility waiting for. If a facility provides a chart on the waiting time, the patient can know what amount of waiting time to expect to wait and decide if he or she is willing to accept that wait time. Having visually distinctive colors for each possible situation to help for will make it easy for the viewer to link the color codes based on the code given below the chart. It will help them anticipate the waiting time if they visit. Before going into detail about the pictures, while our goal is to provide all patients with comfort, it can be more attractive to the website viewer to see children and the elderly look comfortable at the facility, since children may have a harder time processing his or her situation, and the elderly may be the most common type of patient. When we go to the picture on the home page, we see a lady smiling while taking care of a child, and on the contact page, a doctor and elder smiling while the doctor is providing comfort to the elder. Because images can convey to the viewer what the goal of the hospital is, they will make the patients want to go to the facility because comfort and happiness is mainly what they want while going through a sufferable condition. With all that being said, these are the reasons why I think that my new design for the website will impress the members of the medical facility.